Today, let's talk about clinical risk factors and outcomes of young patients with acute ST segment elevation myocardial infarction, a retrospective study. This study aimed to analyze the clinical characteristics and prognosis of acute ST segment elevation myocardial infarction in patients aged less than or equal to 45 years. 701 patients with STEMI from Liaocheng's People Hospital from January 2018 to March 2021 were included in this study. Clinical characteristics, management, and outcomes were compared between patients aged less than or equal to 45 years and those aged greater than 45 years. Coming to the result of the patients with ST segment elevated myocardial infarction who underwent primary percutaneous coronary intervention, 108 were aged less than or equal to 45 years. Compared to the older group, the younger patient group included more males, current smokers, and those with alcohol use disorder or a family history of ischemic heart disease. The culprit vessel in young patients was the left anterior descending artery, which may have been due to smoking. Additionally, young patients presented with higher low-density lipoprotein and lower high-density lipoprotein levels than older patients. Uric acid levels were also significantly higher in younger patients than that in the older group. Diabetes showed a trend toward major adverse cardiovascular events in both groups. Age and sex were both independent predictors of major adverse cardiovascular events in older patients. To conclude, more patients who were smokers had alcohol use disorder or a family history of ischemic heart disease were present in the young patient group. Hyperuricemia, but not dyslipidemia, was a prevalent risk factor in patients aged less than or equal to 45 years. Diabetes should be controlled to reduce cardiovascular events in young patients.